you so much, Kat, and good morning, everyone. Thank you so much for joining our session on health, wellness, and public safety partnerships in Seminole County, a transformed approach to the opioid epidemic. I am Donna Walsh, the health officer here at the Seminole County Health Department, or Florida Department of Health in Seminole County. We're joined today by our panelist, Kelly Welch. She's the program administrator at the Florida Department of Health in Seminole County, also manages the Community Integrated Mobile Health Services team, and also coordinates the NACHO Implementing Overdose Prevention Strategies at the local level grant, along with our partners, AdventHealth and Seminole County Sheriff's Office. We're also joined by the Director of Nursing for AdventHealth Altamonte Springs, Nicole Ayoub, and Dr. Scott Tucker, Clinical Director of Operations at the AdventHealth Hope and Healing Center, along with Captain Sammy Gibson with the Seminole County Sheriff's Office Opioid Unit. Today, you all will hear about the Hope and Healing Center located in Sanford, recently opened. It's part of a partnership between AdventHealth, the Seminole County Sheriff's Office, Seminole County EMS Fire Rescue, Board of County Commissioners in Seminole County, the Health Department, and Wal-Mart. The partnership is intended to transform the way people struggling with opioid addiction are treated by the healthcare and criminal justice systems. Participants today will talk to you about how this partnership works, and you'll also learn more about the Hope and Healing Center, explore how this model could be an emerging best practice for more trauma-informed Central Florida. So with that, I'd like to introduce our first speakers, Ms. Nicole Ayoub, the Nursing Director, and Dr. Scott Tucker.
Good morning, everybody. Thank you for having me here. We're all aware that substance use is consistently a top issue plaguing Central Florida. And at AdventHealth, our commitment is to address the needs of individuals, but also the entire community. And, we want to do that with a holistic focus, getting people well and helping them stay well. So, Seminole County has seen the opioid crisis exacerbated over the past years by the COVID-19 pandemic. And, it's created so many stressors, people losing jobs, people losing their homes, social isolation, loss of loved ones, and just that constant health risk fear that they may contract COVID. And, that's caused a significant increase in substance use disorder. So when we look at the numbers here in Seminole County over 2019 to 2020, Seminole County has seen a 60% increase in overdoses and a 30% increase in overdose deaths. And we realize that people don't just wake up one day and decide that they want to be addicted to some type of substance. So our goal is to break the stigma around addiction and mental illness and try to change the culture and the conversation around mental health and addiction, making sure that, we're seeing the whole person and not just the disease. So we have made quite a few changes here at AdventHealth, and some of them have also been in the ED at the hospital. So Nicole.
Yes, good morning, everyone. So as Dr. Tucker was saying, we realized that we needed to change our model here at the hospital. We were very blessed that Captain Gibson and Sheriff Lima and Donna Walsh and our other community partners approached us a few years ago and said, we've got to change how we treat this epidemic. It used to be a very quick process. You came in the ED, we'd give you Narcan, we'd wake you up, and we would release you. We realized that we needed to put resources in place to allow for us to change what that disposition looked like. So we brought in peer counselors, peer recovery specialists, as well as SUD navigators, substance use disorder navigators. These two entities really partner with being able to identify what that patient is going through, being able to give them hope of where we will be what options there are on the other side of this, and really bringing that culture change to allow for this to be viewed as the disease it is instead of the stigma around it, that there's some choice to it. With that, have been very blessed to have our partners throughout the county with Department of Health, Sheriff's Department, and with Seminole County. And we were able to also open our Hope and Healing Center. So I believe, Kelly, you have a video to play that tells us a little bit about the center.
Let me know if you can't see it or hear it.
Not hearing anything.
Is anybody else able to hear it? Hear it? Okay. Sorry, guys. Hang on one second. Let me try to do it this way.
I know that refreshing your screen might help also.
How about now?
This facility behind us is the Hope and Healing Center, a longtime partnership with the Sheriff's Department, the County Commission of Seminole County, the Health Department, EMS, all of the city officials, Wal-Mart, the Sharing Center. Lots of community nonprofits have come together to develop something that is a recovery center for folks who are struggling with addiction. It gives folks a respite and a chance to break away from whatever environment they're in, to not only receive the therapy, but to get a physical space in their life, a place to recover and get on a different path. These doors are open to somebody who's struggling.
We had 740 people overdose last year, and that is a 60% increase from the previous year, which is already a big number. And these are the unintended consequences.
Ayoub?
An amazing ambassador, really surrounding the community with health and wellness, the generosity that they have given in stepping up to the plate and putting this center and this facility so close to a population who is really, really in need of this is just first of its kind and remarkable, and we're incredibly grateful for their ownership of being a part of the corrective strategy to combat this crisis.
Thank you, Kelly.
Sorry about that.
So here at AdventHealth Hope and Healing Center, we offer a pathway out of addiction for patients that are really struggling with substance use. We currently offer two programs here. One is our intensive outpatient service, and the other is our residential service. And we cover substance-related and recovery-focused therapy and education for our residents and clients here. So we have opened our IOP program, and it's the level of care that's between residential and individual outpatient. So it's a group-based program with 3 hours of group therapy 3 times a week. So it's 9 clinical hours of therapy. And we're, looking at having them learn coping skills and how to manage your triggers and unhealthy behavior so that they can start practicing some self-care. And Kelly, if you want to switch to the next slide. And then we have our residential program also. And really it's for individuals in which their environment is not conducive to recovery. So they come here, and it's a highly structured 24-hour, 7-day live-in program, where they can gain the knowledge and skills that they need for recovery and just to start that healing process. And they get 10 hours of clinical therapy weekly, but they also get so much more to address, the educational, vocational, spiritual, and their behavioral needs. And then, when they leave here, if they're homeless, then we assist in helping them find a place that is conducive for the recovery so that they don't have to, go back out on the street. And then if you want to switch to the next slide, we're trying to confront this crisis from all angles and, just give those individuals the greatest chance of a solution by giving our residents and clients, whole person care. It's essential for the success of individuals to have that opportunity and receive that kind of treatment so they can start that treatment process of walking that life substance free. And we're just trying to break the cycle so that they're not, continually substance, using the substance and going back into the ED and then coming to the center and that kind of stuff. So, we're surrounding them with others that have similar struggles and encourage them, to walk that life and just overcome the adversities that they have, to help them battle back, probably from the lowest point in their life, and help them feel whole again. So, in combination with our programs and in conjunction with the Sheriff's Department and Seminole County and the Health Department, we're just trying to create a comprehensive approach so that those that are struggling with substance abuse, can go through that detoxification process at the hospital and stabilization, and then the treatment here at the center. And then, hopefully it's resulting in fewer interactions with the hospital, with the ED, with law enforcement, so they can live that life that they want to live. And, our hope is, here at the center, we'll not only be able to serve the community needs, but we'll be able to help, those individuals and serve as a model for other hospitals, and law enforcement agencies, around the country. If you want to switch to the next slide. As you can see, this is just a couple of the agencies that we're collaborating with to ensure that we have a successful program. We're partnering with, of course, the Sheriff's Department, which helped us get this all started, and then Seminole County, which has pretty much donated this building to us. We have classes like Yoga for Change, so they come in and they create, and they do yoga classes for us twice a week. We have this SCORE team from the Sheriff's Department come in and just show them that, law enforcement is here to help them for recovery, and then have another resource once they leave. We have Christian Help come in that does resume building and helps them search for jobs before they leave. And then, of course, we have the liver clinic to help individuals that need hepatitis C medication, because that's very, very expensive medication. For our homeless population, the Sharing Center donates clothes and helps us, help them get back on their feet when they leave here. And then with the Health Department to assist in primary care provider appointments and doing health groups. And, also, they've received a grant to help us with a new therapist position so that we can have, our IOP groups in the morning and in the evening. So it's well, and then I can't forget Seminole Leadership, which has come in and really helped us with. They had somebody come in and paint murals that you've seen in the pictures and the videos, and assisting with sponsoring residents to come through the program. And also looking at building a fence, and just so many other things that they've offered and done. It's really the unique thing about the center here is that we have it's a community approach. It's just not an AdventHealth approach or a Sheriff's Department approach or a Seminole County approach. It's the entire community coming together to ensure that we are able to combat this crisis as one and not separately. So, it's one of those things where, at AdventHealth, we're so proud to be a part of this, to have these wonderful partners that we have. And it's one of those things where I believe that it will be a model, throughout the country, and it will be something that Seminole County can be proud of. And I appreciate your time today.
Sure. Thank you so much for sharing, and Nicole, for sharing the center and the wonderful services. We did get a question, perhaps you can answer. Can you talk about who qualifies for the services at the Hope and Healing Center? Just Seminole County residents, those with insurance or without, who would qualify?
So this program really has been grant funded, and also through the Foundation for the Sheriff's Department. We've had huge donations by Wal-Mart, one of our community partners, and then of course the Foundation for AdventHealth. So really this is for individuals that have a substance use disorder as their primary diagnosis, that they really want to walk the path to recovery. And regardless of their ability to pay, they're able to come to the center. It's not, other counties are not excluded. However, Seminole County residents have a priority to coming in. So if we were not full, then we could accept somebody from another county. But if there was somebody waiting from Seminole County, they would be the priority to come into the center. Just because we have so many partners that are Seminole County, and it's focused for here.
Thank you so much, Dr. Tucker. I don't know if you would at this point like to introduce Sammy Gibson from Seminole County Sheriff's Office to talk about the SCORE team.
So yes, Captain Gibson was having a little bit of technical difficulty, so he and Dr. Tucker are sharing a computer. But I'll go ahead, and it's my pleasure to introduce Captain Sammy Gibson of the Seminole County Sheriff's Department, who also SCORE team, the Seminole Collaborative Opioid Response Effort, and my friend, Captain Gibson. Oh, you're still muted, Captain.
How's that? Will that work?
There we go.
We're
Got it.
having some serious difficulties here with the technical stuff. But anyway, thank you for having me, Donna, and it's a pleasure being here. And I'd like to start off by saying, Sheriff Lima is said quite often and continues to say that the number one predictor as to whether someone will overdose and die is whether or not they have overdosed and lived. And we have felt here at the Sheriff's Office that the best way to prevent and eliminate overdoses and overdose deaths is to prevent it from happening at the beginning and to stop it from happening. And, we looked at this non-traditional law enforcement way in that we felt that the crisis we're facing, that we did not, it's the sheriff's position, we do not want to incarcerate sick people, but instead we want to help sick people get well. And so we started looking as this started impacting our community and what we could do. And as you know, for those that are listening, we have the Seminole County Opioid Council that consists of over 100 members, community members, both from law enforcement, from our health providers, our treatment providers, our judiciary, and other community leaders. And through that program, we were able to determine and look at this. And, everybody that was involved in this and is involved in this was doing a great job. For example, law enforcement, we did a great job. We would respond to overdoses. Our healthcare providers, as Nicole stated earlier, our hospitals, our emergency rooms, they would triage those coming in for overdoses, but then they would turn around and release them back into the environment that caused it to begin with. And we found that they would overdose sometimes hours later or days later. And what we found was that we were all doing a great job, but we were all operating within our own silos. And that prohibited us from really providing the best service and continuum of care for those that are battling substance use disorder. So what we did is we tried to work together and tear down those silos and have a more holistic approach in that the sheriff, we started our SCORE program, which is Seminole's Collaborative Opioid Response Effort. And we have investigators that are assigned to that, and they respond to all non-fatal overdoses in Seminole County. And instead of just responding and documenting it and then providing that first responder care and shipping them to the hospital, we felt that we needed to do more from a law enforcement standpoint. So what we did is we partnered with our healthcare providers, Department of Health and AdventHealth and other hospitals, emergency rooms, to say, okay, we as law enforcement, we're gonna work as that navigator. We're no longer just gonna put them in an ambulance, send them to an emergency room, and then have them triage and catch and released out and have to deal with it the next day. So what we do is we respond to those non-fatal overdoses, and we offer services. And that what was important and what's important with this is truly having that community partnership with all the stakeholders. So when we come in contact with that victim of an overdose, and we offer them services, that we have a place to send them to receive the services that they need. And that was one of the things we identified that was lacking. Although we had the emergency rooms, we had treatment providers, we had detox facilities, what we found was that those battling substance use disorder were unable to navigate the difficulty of trying to get in the services on their own. So that's why we took here at the Sheriff's Office, we have taken on that responsibility, kind of work as that navigator. And that's kind of the birth of where the Hope and Healing Center came from. We felt we needed a place, a one-stop shop, if you will, that we could take those people that needed help, that wanted help, where we could take them and from the time they overdosed to the emergency room, from the emergency room, a continuum of care into whether it be residential treatment or intensive outpatient treatment. And so we decided to look at how we could partner and provide such a facility. And we happen to have that right here. The county had an old work release center, which is where the Hope and Healing Center is now. It was a work release center where inmates would actually go to work during the day and they would stay at the center at night. That program since went away. So we were able to, the county commissioners approved that to be used for this purpose. But and what this has done is it's really, it's brought us all together as a community. It's brought the stakeholders together, and really, truly, I believe it's increased the quality of care and will ultimately, reduce our overdoses and overdose deaths. And I will say that on top of that, this center and this program has cost the taxpayers of Seminole County nothing. It has all been done through grants. It's all been done through in-kind contributions and through financial contributions. So, it's just a matter of getting all the stakeholders together and realizing that, listen, if we don't do this, then there's nobody else that's going to, and tear down the silos, look at it as a holistic approach, come together and get things done. It should give you a quick number on our non-fatal overdose responses. Of course, we also respond to fatal overdoses and investigate those as if they were homicides. But on the non-fatal side, to give you an idea how this collaborative effort works with Advent and the county health department and our other treatment providers here in Seminole County, our two investigators that respond to non-fatal overdoses in the year 2020, last year, they had 1,516 contacts with people battling substance use disorder. Now, those may have been repeat contacts, but we made personal contact with 301 people that experienced a non-fatal overdose. We were able to get 124 of those 301 people into treatment. That's 41%. So prior to us implementing the SCORE program, we had 0% of those overdosing actually navigating and getting into treatment. But just last year, we have a 41% success rate of those we have made contact with after an overdose, and we're able to get them into services. And so, you know, we're headed in the right direction. But Donna, that's I kind of wrapped that up.
Thank you so much, Captain Gibson, for sharing with us and for our partnerships. I do have a few questions. Before turning it over to Kelly. There was a question about whether or not the Hope and Healing Center and the SCORE team, do you all connect with the 12 steps programs of AA and NA, Alcoholic Anonymous and Narcotics Anonymous?
Yes. So we actually have AA and NA. We have AA and NA that actually come into our program in the evenings, and so they're able to get that type of program every night while they're here at the center, and then they're required from our IOP program to enroll in an AA or NA program. So yes, we're definitely in communication with, and they all have access to AA and NA.
Thank you so much, Dr. Tucker. Just a follow-up question to the initial question on qualifications for the program is what do we do with folks who might be undocumented, or what sort of documentation is required to enter the program?
As far as individuals coming into the program, everybody that is coming to the residential program here goes through the hospital. So they'll be able to get, you know, their COVID test completed there. They'll be able to get a history and physical by a physician for any medical needs that they have. And then from there, our substance use disorder navigators help navigate that system. So whether they come here, they go to a different program, you know, they try to find the right fit and then go from there. As far as our intensive outpatient program, all they have to do is contact our center directly, and we are able to help them from there.
Much. So Kelly, our program administrator here at the Florida Department of Health in Seminole County, will talk to you more about our partnership and the Community Integrated Mobile Health Services team, as well as the recent NACHO grant partnership with the Sheriff's Office and AdventHealth.
Thank you, Donna. Thank you, everybody. I hope you guys can hear me okay. I'm trying to go between the microphone and the earphone so you don't get any feedback from me. So I apologize for that. But happy to be here today to talk to you a little bit about a grant that we were fortunate enough to learn about back in October of last year. We were notified of a grant opportunity, and with a very quick turnaround and some communication with our partners, we went ahead and submitted the grant proposal, and in November we were notified that we were awarded a $500,000 grant to combat the opioid, to assist in combating the opioid epidemic here in our community. So the grant involves, we affectionately call it the IOPSL grant. It's implementing overdose prevention strategies at the local level. So our grant, the basics behind that is not to take away from the services that are already being provided in our community. We are very fortunate to have some really great services, such as that Captain Gibson and Dr. Tucker and Nicole just spoke about. We wanted to bring an overlay service with the community paramedicine model. That's a model that we utilize here at the health department. Through Community Integrated Mobile Health Services. It's an established program that we have where we target certain chronic illnesses and try to reduce hospital readmissions. And we do home visits and health screenings and education that's specific to the nature of illness for each individual. So we thought about taking that model and overlaying the services that are existing and trying to make a change in our community. So through the funding that we received, and this is through CDC and NACHO, the National Association for City County Health Officials, we still work very closely with the Seminole County Sheriff's Office, SCORE team, AdventHealth, Orlando Health, we had some meetings with. And based on that, we pulled a lot of data from a variety of different sources to find out where we need to target some of our resources. And so with the community paramedicine model and community integrated mobile health services, we have the mobile team that's able to respond in the community and do outreach services, health screenings. These are paramedics. They're very easily approachable, and they do health screenings, blood pressure checks. We do a variety of adult vaccinations. And the health screenings really are to target if there's any chronic illnesses that we can handle and give appropriate referrals for. And also with this particular population, this is a way to get in the door. And so what we want to do with this specific population is have a kind of a kinder, gentler approach to going in there and talking to them and trying to find out specifically if there's an opioid issue due to a pain management concern. So we can work closely with their primary care physician and any of their medical providers to work with them to try to manage that and have that be taken off the table as a reason for them to potentially have an overdose for opioids. So this is a graphic that was recently pulled that kind of shows where overdoses occurred within the county. So we are targeting these specific populations and these communities to bring the mobile services van out there and provide health screenings to that community, and hope that we'll be able to engage folks in this program and so that we can follow up with them at their home. We do a pre and a post assessment to try to target the specific dimensions they're called, that we can kind of target what referrals are needed, what type of specific education is needed, and make sure that they're receiving the appropriate referrals and resources that they need. So how this works, this is just a basic diagram of we receive the referral from the SCORE team or a community partner, and then the community paramedic deploys out to the home. They try several times normally to make contact with the individual, and then we will do the pre-assessment. This is a 3-part personal wellness assessment. There's 3 domains: the physical, emotional, and social. So we may not do all of those at the initial visit. We do build the rapport first. So we'll come back multiple times, and depending on if they're feeling extra chatty, we'll go through those 3 domains. It's a very brief assessment. And then that helps us to target what type of referrals and services that we can provide that will help the individual move towards a mindset of wellness and recovery. So once that, again, there are some that we go out multiple times, and then we are getting lots of referrals for this program. So we do inactivate them. We do leave some information. We contact often. We speak with family members and leave them with some information on how to connect with us. And we will always go back out if necessary. And that's just a picture of our mobile services van. Hopefully you've seen that in the community. And we have some other initiatives that we overlay with this. This is a picture of a food initiative for food insecurities that we're working on right now. So we try to bring some of these initiatives into the home as another means of connecting with the individual and trying to assist them holistically. We also, part of our funding for this grant, we requested funding for a campaign, a marketing campaign. So right now you should see, if you're living in or traveling in the Central Florida region, please be on the lookout for these. There are 9 billboards within Seminole County, and you can see what the billboard looks like there. And then there are Lynx buses that are wrapped. Several of them have it completely around the bus, and some are just on the back. But those are traveling. They wouldn't promise just Seminole County, but they're traveling through Seminole, Orange, and Osceola County. So be on the lookout for those. That's all part of this initiative and funded through this grant. And as Dr. Tucker had mentioned earlier, we're also funding a therapist over at the Hope and Healing Center, because with this collaboration with the Sheriff's Office and AdventHealth, while the community paramedic is in the home, we are able to make that immediate connection. So if we're able to talk to them about the options and the Hope and Healing Center and other options that are available to them, we connect immediately with them and try to get them the help right away. So that's part of the funding as well. So, and I'll be remiss not to mention that, and I know my co-presenters also mentioned this, but with this absolutely would not be possible without the partnerships that we have here. We're very blessed in Seminole County, have some wonderful partners And this is a very collaborative project. We hope to see some really good impact from this initiative. It's 18 months or so. We will ask for that funding to be increased beyond that. So we're hoping to be able to present some really good outcomes after the end of that time period. So with just 10 minutes left, I'm going to send it back over to Donna so that we can open it up for questions. And please, there should be a link in the chat box too. There's a survey to take, if you can take some time and fill out that survey for us. And I'll turn it over and I'll stop sharing my screen now.
Thank you so much, Kelly. Thank you, Dr. Tucker, Captain Gibson, and Nicole, for all of your work in the community. As mentioned, we are very blessed here. We're very fortunate to have the partnerships we do to address this very critical issue in our community. At this time, I don't see additional questions in the chat any comments. However, I would like to open it up for any additional comments that any of you all may have while we're waiting to see if others who have joined us might have questions. I am not hearing anything. Okay. Dr. Tucker, can you mention, I know that you mentioned when the Hope and Healing Center opened, but are you able to share how many services or individuals you've been able to assist at this point? I think you're on mute still.
There we go. Sorry. Yes. Our intensive outpatient program opened up on February the 15th. We started our first outpatient person on March the 1st. With that program, we've averaged about 9 to 10 individuals in each one of those groups. We've had 4 that have actually completed their 4 weeks in intensive outpatient. So we've had 4 success stories for intensive outpatient. We have a couple more that are actually going to graduate tomorrow, or actually on Friday. So, it's with that program, they come in, they have 4 to 6 weeks of treatment based on their treatment plan. And then we step them down to a lower level of care, whatever resource they need outside in the community. For a residential unit, we opened that on March the 9th, and we have had an average of 6 to 7 individuals out of the 10 open beds that we have here. Sometimes a little bit higher and sometimes a little bit lower, but an average of 6 to 7 individuals in that program. And we have had a couple that have successfully completed that program. So all in total, I believe it's been 25 individuals that we have had come through our services or currently in services since the 9th of March. So it really has been very successful. We've been able to see people really transform here at the center. One story I can share with you is we had an individual, our first resident that came in, and our first resident that graduated from a 30-day program. He was met upon his discharge from his wife and family. And when she walked up, the tears in her eyes, just because she said, "I've never seen him so healthy, and I've never seen him look like that." So, he's been struggling with addiction for so long that, we've seen the other side, but we haven't really been able to see this side in such a very, very long time. So it was nice for, the staff here to get to witness what it is that they've been able to help this individual do on his journey. and of course, wishing him all the success in the world. But our doors are open to him or any other individual that would need our services again. So, it's definitely been a very rewarding here on this side of it.
Thank you for sharing that. It's a beautiful story of a success story. I know that folks who are attending the conference would like to know, I'm seeing a couple questions here, how these services relate to the positive and adverse childhood experiences and ACEs research. And I think, what you just shared certainly aligns with those principles, but I don't know if any of our panelists would like to address that.
About another initiative that we have that specifically, it's actually a grant through Orlando Health that is targeting ACEs, and we also utilize this as a service that we provide, and for this grant as well, where if an individual has applied for, or they haven't done their taxes yet, or they're doing their taxes next year, we're giving them education about the earned income tax credit. So there's an initiative right now that applying for and receiving that additional funding assists with, and they're looking at this holistically to see if there's any outcomes about the ACEs and reducing the adverse childhood experiences when those are related to insufficient income in the household. So that's an initiative that we're doing right now. So the community paramedics are actually utilizing that grant as well when they go into the home to give education about that particular opportunity, because there's free tax preparation. There's a lot of information that they can educate themselves, even if they have applied already this year. It was a little bit of a late start, but they'll have information throughout the remainder of the year to be able to apply for that service, and in the hope, and then we'll follow back up with those individuals that are participating to see if that was an impact and had an impact in regards to ACEs. So that one is specifically tied into that particular program.
Thank you for sharing that, Kelly. And certainly, I know that there's a question here about the type of training that we receive, the officers, nurses, counselors, and so forth on adverse childhood experiences. And I turn to Captain Gibson, Nicole, and Dr. Tucker. Certainly in public health, we're well versed in ACEs. And so I know in your training, as well as clinicians, and providers, if you wanted to share what type of training you receive and how you translate that into the services you provide. I see Captain Gibson coming over to Dr. Tucker's spot here.
Oh, multiple group, aren't we?
Yes, we are resilient and very creative.
While they're getting set up, I'll address the other question. There was one about connecting with some of the recovery programs and 12 steps. We are working on an initiative right now where we're identifying the transitional housing communities in the area, and we're going to connect with all of them to bring the mobile services van out there and offer services there and try to connect them with this program as well. So our NA and AA meetings as well, we'll be making connections directly with the in-person sessions that are happening here in the county.
Captain Gibson, if you can unmute, I think we'll be ready.
He's definitely having technical issues over here with the microphones and things like that. But I can tell you that they get as far as training goes for here at the center. We were definitely very lucky before we opened up the center to have a very long time where we're able to train our individuals here on best practices and what we're able to do as far as from a clinical standpoint from our therapist, and then also our behavioral health techs and our LPN nurse supervisors are here overnight, so that helping them understand how did these individuals get to where they did, and understanding what it is that they need to know so they can better assist those individuals, from a standpoint of, how did they start? Was it an injury, or was, that they started taking, some oxycodone from the hospital, or, what was it that got them into this type of situation? Because they didn't choose to do it. They're individuals that are just like you and I, that had some type of misfortune, and where, they started down this path, and they're just having a difficult time, recovering. So, we're here to help as far as that goes. And then, we have so many partnerships within the community that we can help establish treatment once they leave, whether they need primary care doctor, whether they need an outpatient therapist, or whether they need clothing because they don't have any, they're homeless, or connecting them to a sober living house, or any number of things that meet the needs of each individual when they leave, because they are individuals, and each one of them have different types of needs. So it's not one size fits all. It's let's help them and meet them where they are, so that we can give them the services that they need as they leave the center here. So it's really a whole approach to everything.
So much for sharing. And Kat, I'm going to defer to you. Are we getting close to the end of the session? I just want to thank again all of our presenters today for the wonderful work that you're doing, the partnerships. We're looking forward to continuing to help those in our community and in Central Florida to heal. And so thank you so much.
Yes, thank you to all of our Seminole County partners. Just a perfect example and model of community working together to help us have a resilient community, which is what this conference is all about. So you all are very important pieces to all of that. So thank you. And so in the agenda, at 11 o'clock will be one of our first community panels. It'll be in the stage area that you'll find on the left-hand side. And there'll be two panels today. So there'll be one panel, then a break, and then a second panel. So we hope to see some of you there with that. So thank you again, Seminole County. And we will cross paths again, I hope. If you have any last questions, we're here for a minute or two.